COVID vaccines are now available for children as young as 6 months old. It's just another major step being taken in the coronavirus pandemic. Medical editor Dr. Dave Hnida is here joining us now. Good to see you.
Good to see you.
Okay, Dr. Dave, so how is this vaccine for young kids different? What do parents need to know?
Well, several things. You know, it's funny because right now it's Pfizer and Moderna that are going to be utilized in kids 6 months and older. Basically the same vaccine is given to adults, but in mini doses and a little bit of a different dosing regimen. I think for a lot of parents, there are still a little bit of questions and concerns when you take a look at the numbers out there in terms of who is going to get their kids vaccinated. About 20% say, yeah, we can't wait for this vaccine to be available. Can't wait to get in and see my doc and get my kid protected. About 40% of parents are kind of on the fence, a wait and see attitude at this point in time. They are basically saying, let's just wait a little bit, let's see how things go, and then we'll consider getting our kid vaccinated. And then you take a look at 40% of the remainder. And it is like, well, I don't think we're going to vaccinate our kid at all. So there really is pretty much of a spread. And I think over time, there will be some shift in those numbers. The biggest questions that we get from parents, the first one is always, how safe is this vaccine? And it is very safe. We have really seen some good statistics and information come out of the studies that were done before release. I think that when you take a look at side effects, most kids really get none. If there are side effects, they are along the lines of what you see with other typical childhood vaccinations. You could get some fussiness, you could get maybe a touch of fever, things along those lines. The things that were not seen in any of the trials were things like inflammation of the heart muscle, the myocarditis and pericarditis. That really was something that tended to be a problem or more common in young males, basically teens and young adults. Also, no blood clots, which was an issue with Johnson & Johnson vaccine. So from a safety standpoint, I think we're really good in that regard. And then the next thing that people have been asking is, well, just how effective are these vaccines? And the answer, they're good vaccines, especially for what's going on right now. When you take a look at Moderna vaccine, it is about 51% effective at preventing any symptomatic disease in kids. And really what we're looking at here is against the Omicron variant, because that's the dominant variant that's going around right now. That does tend to drop off a little bit as you start getting into the age 4 or 5 age group, but it's still, once again, very effective. And we think the numbers are pretty much the same when it comes to Pfizer. So I think from an effectiveness standpoint, it's a good vaccine. The other thing is that a lot of folks are saying, just really how necessary though is it? I mean, kids generally, they don't get that sick, but the point is kids do get sick. It is certainly true that it is something that tends to be less severe, less hospitalizations, fewer deaths among young children as compared to adults. But nonetheless, kids still do get sick, still wind up being hospitalized. So I think it is very effective, really, in that regard. And then I think you need to take a look at who these kids are around. Parents, grandparents, other family members, people who are older, maybe have some pre-existing medical disorders. And so I think there's another layer of protection within the household and with immediate contact. So I think it's a good idea from that regard. The other one that really comes up very frequently is, which vaccine should my child get? Should it be Moderna? Should it be Pfizer? And I have to tell you, we have dealt with this in our own family, answering that question. And I think at this point in time, very frankly, most experts are just saying it's a coin toss. They're good vaccines, they are effective vaccines, they are safe vaccines. It really is what you are offered by your pediatrician, healthcare provider, and so forth. And that does lead to the next question: where can I get the vaccine? And usually it is something where we do recommend that you see your pediatrician, primary care healthcare provider. We also are seeing hospitals distributing the vaccine, administering the vaccine to youngsters. Community healthcare clinics are. One little thing that comes up though too is pharmacies. Pharmacists are by law not allowed to administer vaccinations to children under the age of 3. And so unless there is a healthcare clinic associated with the pharmacy, it's not going to be that very young group that's going to be able to get it at a pharmacy. So I think the best advice is to be in contact with your healthcare provider and get a little bit of guidance about availability and get the vaccine taken care of. I think bottom line, it is something that really should be taken care of. It will certainly protect the kids, certainly protect the family, not just from a health standpoint, but also take a look at it from just the dynamics of the family. A lot of parents, they wind up getting a sick kid. That means daycare's out, preschool's out. Parents need to miss work in order to be with their child because they can't be around others if they're ill. So there are several dynamics that come into place here. And I think getting the vaccine is really a good thing. And I really recommend it and hope that parents are going to be able to take advantage of the fact that it is now available.
Dr. Dave, one question that pops up in my mind, just being the mom of 3 kids, and I do have a 6-year-old, she's about to be 7, but when you're talking about kids 5 years and younger, they're already getting a lot of vaccines at that point. And so a lot of parents might have that wait and see type of game because they're already getting vaccinated with all of these other vaccines. Is that okay to add another one on?
You bet. Certainly a little bit of concern about that is something I respect on the part of parents. I mean, there has always been talk. It's like, boy, we're just jabbing our kids with everything under the sun these days. And now you want to add another one on there. But it was shown that you can administer this vaccine at the same time as other childhood vaccinations. No interactions, no more problems than you would otherwise see. So the vaccine can be combined safely with other vaccinations.
All right, so let's talk travel now. We know the United States no longer requires a negative COVID test in order to return to the country. Of course, this is a big change a lot of people have been waiting for. What do you think our viewers should know about traveling right now?
Well, the big thing is that if you're traveling back into the United States after going somewhere in the world, it certainly is a lot easier than it was just several weeks ago. I think the big thing is there is no vaccination requirement to come back into the country if you are a U.S. citizen or you are a legal resident. There is no need to be tested before coming into the United States. But the big thing to know about that too, though, is that if you are not a U.S. citizen, you still need to show proof of vaccination before coming back into the country. So if you do have people coming in, they need to have proof of vaccination. Relatives, for example, who are not citizens, it is important that they do have proof of vaccination before coming into the United States. Despite all that, the CDC is still saying, number one, if you are sick, you should not be getting on an airplane and flying back into the United States. The other thing is that they do recommend that the folks, when they get back from travel, perhaps consider getting a COVID test 5 days after they return. And so that's something to keep in mind as well. I think that it really is something that is an appropriate, getting rid of the requirement is appropriate. And the reason for that is I don't think it really did much in terms of slowing spread of the virus worldwide. There have been studies that have been done that show that having people meeting all of these requirements really did not make a big difference over the past couple of years. And actually it was more masking than anything else that was the most helpful thing. And you see where masking has gone. Masking is totally gone. I think on a personal standpoint, just as uncomfortable maybe getting on a domestic flight as I am on a international flight coming back into the country, just because I get, concerned about people not wearing masks, being ill, spreading the virus, and so forth. So I think that that's really a concern, whether I'm flying from LA or flying in from London. To me, it's an equal deal. So I'm still masking up. Doesn't mean that others need to mask up, but I still think that it is an advisable thing to do. It's certainly, though, having these other requirements change is going to make travel a lot easier.
Well, a lot of good information there, Dr. Dave. Thanks so much for talking with us and, of course, for your expert opinion.
Thank you.
All right. We'll be right back.